Welcome to our video on the symptoms and prevention of tooth cavity. Tooth cavity symptoms may include visible holes and stains on the tooth surface. They may also be caused by sugary or starchy foods. These can be caused by various reasons, such as genetics or environmental factors. To prevent tooth decay, you should visit your dentist every 6 months for a checkup. Below are some tips to prevent tooth cavities. Keep watching to find out more. Let's face it, most of us can't stop eating those sugary and starchy foods. Dental caries. The stages of dental caries can be classified as either acute or chronic. The main characteristic of both is acid demineralization of the dentin, which is the tissue that makes up the tooth. As caries progress, the dentin begins to break down in 3 areas. These areas are known as the surface zone, the dentin body, and the advancing front. The surface zone shows the earliest signs of dental caries, and it contains the most caries-causing bacteria. Once the sugars are broken down by the bacteria present in the mouth, they turn into acids, which can weaken the structure of the teeth. The acid attacks the enamel and leaves tiny holes. This is the beginning of dental caries. When this happens, the teeth are unable to reinforce themselves with calcium and phosphate naturally. During this process, the acid begins to penetrate the tooth structure and eventually destroy it from the inside out. Fortunately, there are many treatment options available for this problem. In addition to severe dental caries, the condition may also affect a person's quality of life. These problems can interfere with eating and sleeping, cause pain, and adverse growth patterns. In children, caries can lead to tooth loss. Further, children who suffer from dental caries are often absent from school or work because of tooth decay. The sooner they seek treatment, the better. A timely visit to the dental clinic can prevent tooth decay and save a tooth. Plaque. Although plaque is inevitable in all mouths, it can be prevented. By following a good oral hygiene routine, you can help prevent plaque from forming. Also, certain foods contribute to plaque formation. These foods include milk, soft drinks, candy, and cake. By limiting sugar and carbohydrates, you can help prevent plaque buildup. Visiting your dentist at least twice a year will help you maintain a healthy mouth and prevent cavities. Bacteria that live on our teeth start causing cavities when they consume carbohydrates. When this happens, they start to form plaque, which in turn creates acid. The acids that these bacteria produce will eventually erode tooth enamel. In time, this can progress to more serious stages of the disease, including tooth decay. Once this stage progresses, it can lead to sensitivity, tooth decay, and even tooth loss. To prevent plaque, brush your teeth at least twice a day with fluoridated toothpaste and visit your dentist regularly. Be sure to mention any medications or medical conditions you may be taking. Bacteria in plaque form a sticky film on teeth, making them feel fuzzy and sticky. In addition to causing cavities, plaque also causes gingivitis and periodontitis, which are inflammatory conditions of the gums and teeth. Untreated, plaque can cause infection and lead to tooth loss. By brushing your teeth twice a day, you can eliminate bacteria and protect your mouth against tooth decay and gum disease. Sugary foods. It may seem that sugar is the culprit in tooth cavities, but this isn't true. Sugar actually attracts harmful bacteria that attack the tooth's enamel. While eating a sugary diet isn't the main cause, it certainly increases the risk. Regular dental cleanings are essential for keeping plaque at bay and preventing cavities. Also, avoid the consumption of sugary foods after meals, because frequent snacking can increase your risk of getting cavities. In addition to sugary foods, soda and other sugary drinks can cause teeth decay. Soda contains acid and can increase your risk of tooth decay by 31%. Beverages that contain high fructose corn syrup are especially harmful. These substances coat the teeth with an acidic film that is an ideal breeding ground for bacteria. Drinking soda can also lead to gum disease. In addition to cavities, sugary beverages can lead to a host of other dental problems. While sugar itself doesn't harm your oral health, bacteria found in mouths are responsible for creating acid that dissolves tooth enamel. This process happens over a period of 20 minutes, and it takes a while for the pH in the mouth to return to neutral. This is why sugary foods and drinks should be avoided on a daily basis. Also, if you must consume such food or drink, it is best to use a straw to limit contact between the teeth and drink. Gum disease. People who are at risk of developing gum disease often neglect to brush their teeth. This can lead to a buildup of tartar and plaque on the teeth and can cause gingivitis. In addition to gum disease, people with certain risk factors are often pregnant, diabetic, or take certain medications. However, the early stages of the disease can be reversed with daily brushing. Here are some tips for treating gum disease. The most common cause of tooth decay is bacterial growth. These bacteria convert sugars found in food into acids and attack your teeth. The most common type of bacteria in your mouth is Streptococcus mutans, which naturally lives on your tongue and feeds on sugar found in snack food. Even though you might not notice any symptoms, the buildup of plaque can result in painful abscesses. Other symptoms include persistent bad breath, swollen gums, and altered bite. To treat gum disease and tooth decay, a dental professional will perform a deep cleaning, known as scaling and root planing, to prevent bacterial growth. People with periodontitis should continue to practice good oral hygiene and see their dentist regularly. They should also quit smoking and sugary foods and snacks. Brushing for 3 minutes a day is recommended. Patients with severe cases may need more extensive treatment, including deep cleaning of the root surfaces of their teeth and oral medications. Corrective surgery may also be necessary. But, if you are at risk of developing periodontal disease, seek treatment as soon as possible. Dental X-rays. The process of finding out if you have a tooth cavity begins with a dental X-ray. These images show the inside of the tooth, including the pulp chamber, where the nerve tissue and other tissues are located. Cavities are areas of low mineral content, often accompanied by a dark spot. The decayed area must be treated promptly. Luckily, dental X-rays are relatively painless. Dental X-rays can also detect decay between teeth and between the teeth. They can also reveal changes in the bone or root canal caused by an infection. These images are also useful for detecting abnormalities of the teeth, such as impacted teeth. Dental X-rays can also determine whether the mouth is wide enough for an incoming tooth. These images are also helpful for detecting cysts, tumors, and other problems in the mouth. Depending on your age, your dentist may recommend a dental X-ray every 2 years. However, if you have no dental problems, a dentist might recommend that you visit the dentist more frequently than recommended. Some dentists recommend X-rays every 3 or 4 years for healthy adults. If your dentist sees an early cavity, you may be able to save yourself a lot of pain. Root decay. The symptoms of root decay in a tooth cavity can vary from mild to severe. It can result in a toothache, sensitivity to cold, or redness around the mouth. While early tooth decay may not cause pain, the pain is more pronounced if the decay has progressed to the pulp. The pain will continue to persist despite measures taken to relieve the discomfort. The pain may also radiate to bone or other tissues around the mouth. A dental checkup at least twice a year is vital to catching cavities early. A dentist will use various tools to examine your teeth and probe the decay. Root decay is more visible in back teeth because they have multiple roots and grooves. Therefore, they are more difficult to clean than front teeth. If you have a tooth cavity and notice that the pain you feel is accompanied by swelling or a lump in your mouth, you may have a root infection. This infection can move to the innermost layer of the tooth, which is composed of blood vessels and nerves. Once bacteria reach this area of the tooth, the infection may progress to stage 5. An abscess in the pulp is extremely painful, and the infection can affect the bone. Stage 5 tooth decay usually requires dental surgery to repair the damage. Filling a cavity. The purpose of filling a tooth cavity is to prevent further damage to the tooth by restoring its structural integrity. At the same time, a filling helps to protect the tooth from the bacteria that can cause cavities. A dentist will often use a tooth-colored filling as this bonds securely to the tooth structure and provides an even stronger barrier. However, it is important to be aware of the risks and benefits of each type of filling. In order to prevent further decay, it is important to get your cavity filled as soon as possible. When you wait to get it filled, bacteria and food particles can accumulate in the empty space. Furthermore, the gap will expose the dentin, which is the second layer of the tooth underneath the hard outer enamel. Dentin is sensitive, so if exposed, it can lead to further decay and even the need for extraction. If you have recently had a cavity filled, your dentist may offer you a discount for a replacement filling or a goodwill adjustment. While cavities can be difficult to detect, it's vital to visit a dentist as soon as possible. Cavities can begin with a small, dull pain when eating certain foods. However, if left untreated, cavities can cause severe pain for hours on end. However, they're often very easy to treat. Fortunately, a dentist can fill a cavity in as little as an hour or two. There are some common risks associated with tooth decay and cavity filling, so it's important to know about them before your appointment. Thanks for watching. Please like, comment, and subscribe for more.